Hi, Danielle.
Hi.
How are you?
Good, how are you?
I'm fine. I'm Nurse Tessa.
Hi.
And I'm Dr. Angeline.
Hi.
How are you?
How you feeling?
I'm having a little bit of pain in my stomach today.
Yeah.
Well, I do see that you're in here for a pancreatitis, so that can definitely be part of it.
Okay.
Doctor, did you have some labs back?
Yes, your lab results came back abnormal for type 2 diabetes.
Diabetes?
Yes.
She's so young. Does she have to take insulin, or can she correct it with diet and exercise?
I don't want to poke myself.
Well, you don't have to poke yourself since you're insulin resistant, then you just be taking all medication and along with diet and exercise.
Diet and exercise is definitely going to be very important for you. I do see you're 17, is that correct?
Yeah. What about like Diet Mountain Dew?
Diet Mountain Dew is not going to work. Any sodas are not going to be good for you. I do feel that water is going to be your best friend.
That doesn't taste good.
Yeah, you can put a little bit of lemon in it.
You could just drink the water, Danielle. It's not going to kill you.
Mike.
So will your sugar going up?
We do have some ideas for you for some oral diabetic medication. Go ahead and Dr. and I are just going to step out and review some medications. We'll be right back in, okay?
Thank you.
Mom.
I need that.
Did you see that? No wonder she's a diabetic.
Didn't see that. Okay, well, I think we've come up with about 3 different oral medications that would work for her. After reviewing her history, we have pioglitazone. Miss Danielle did state to me that she is sexually active and she does not prefer to use condoms. So this pioglitazone does decrease the efficiency of the hormonal contraceptives. I don't think that's going to be a very good choice for her. Also because she has the pancreatitis, that is a contraindication for the other oral med, which is the sitagliptin. It's also hasn't been established yet for safety with pediatrics. It looks like maybe the only one we have left is the repagliadine. What do you think about that?
Okay, I think that's good. I think we should go ahead and give her the minimum dose, and we'll take it from there, monitor her glucose.
Yes, yeah. The periodic monitoring is going to be important with that one. Probably starting her out low and kind of seeing how it works for her.
Yeah.
Okay. All right, do you want to go back in and talk to the patient?
Okay, sure.
Okay. Hello.
Hi, Danielle.
Hi, Danielle.
What bad news did you bring this time?
It's actually good news. We're going to have some medication for you that will help assist with monitoring your blood glucose.
Okay, so after reviewing your medical history, we're going to go ahead and start you off on repagliadine. You're going to take 0.5 milligrams at the minimum dose 30 minutes before meals, before every meal. And if you happen to either, miss a meal, then you can skip a dose and add a new dose.
Is she going to have to do a finger stick every day, every meal?
No, not necessarily. We're just going to be monitoring the blood glucose periodically, so nothing is fixed.
You'll just do periodic checkups, but you will not need to do an everyday finger stick since you are on an oral medication.
So what if I just stop eating everything? Then I don't have to take that med, right?
No, that'll bring up a whole other set of problems. So we do need to get you on a good diet and exercise plan to keep this under control.
So you can
This is
join a
going to be
gym.
a long term. Yes, that's a very good idea. Do you have any other questions for myself or for the doctor? We can get this sent over to the pharmacy. I'll pull up some education for you right now and just get you some information about type 2 diabetics and what they can do to help them through this process.
Are they going to send me up a breakfast? Because I'm hungry.
We'll get you something healthy, yes.
Okay.
Thank you so much.
You're welcome. You guys have a nice day.
Thank you.
Hey, Nurse Raquel.
Hey.
On our gentleman, 17-year-old, we're going to go with, he's got type 2 diabetes.
Mhm.
And I think we're going to go with metformin as a drug of choice, because that's going to be our first choice when we're newly diagnosed, when we're treating newly diagnosed type 2 diabetes. And he doesn't have any contraindications to it. If he did, then we would look into going with glipizide or acarbose. But since he doesn't, we're gonna not go with one of those. And also with metformin, since he is 17, if he misses a dose, he can take another right as ASAP. Or with the other two, he would have to
Okay.
You can't do double doses with those. So let's go in there and let them know what's going on. How you doing, sir? So the lab values came back. It turns out you have type 2 diabetes. So as a result, we're going to put you on a drug. It's called metformin. Starting out, you take it orally. You take 850 milligrams every day. And then every week, we up that dose, 500 milligrams, up until you reach 2,000 a day. So we're going to give you directions to go ahead and take it home with you. And you're going to divide that dose up 2-3 times between all your meals.
Okay.
Did you have any questions about it for me?
Yeah, so I'm taking other medications, so is this have any drug interactions with this?
So there are a few interactions with this drug. The doctor and I are going to go over your medication list and make sure that you don't have any of those, but they are drugs like asthma medications, cold medications, anything that raises your blood sugar. Another thing that you need to know are the adverse effects such as abdominal bloating, nausea, vomiting, things like that. Just make sure you call your provider and if you experience any of those symptoms.
How long does he have to be on this medication?
So this medication is long-term. He's going to be on it indefinitely. Okay, he's going to use it with diet and exercise. The doctor may also prescribe him some insulin as well. Do you have any more questions for me?
So you said take it with meals. Like, what if he, he's like working a long shift at work, and does he just take the medication?
It's okay
regardless,
if you
or-
miss a dose. Just take it as soon as you remember to.
Okay.
Yeah.
And how will we know if his blood sugar is too low? What are the signs of that?
So symptoms of hypoglycemia are weakness, fatigue, sweatiness, irritability. So if you see him doing any of those things, just make sure you call us immediately. And also, it's good to keep a sugar supplement nearby, like glucose, honey, orange juice. Just keep that nearby in case you see any of those symptoms. Do you have any more questions for us? Okay.
No.
All righty.
I guess. Thank you.